Can you tell me about yourself and your clinical background?
I have over 3 years of clinical experience as a registered nurse in adult medical, surgical, and acute care units. My daily work involves comprehensive patient assessment, medication administration, emergency interventions, post-operative care, and collaborating with multidisciplinary teams to ensure safe recovery outcomes. What I enjoy most is the mix of hands-on clinical work and being the person patients trust when they're scared or confused about what's happening to them.
Why do you want to work as a nurse in this country?
I want to practice here because of the high standard of evidence-based nursing care, clear structured pathways for professional advancement, and access to modern healthcare technology. Practicing in this system will enable me to deliver quality patient care while continuing to grow clinically, and I also want to challenge myself in a different system and bring that experience back into my practice.
What are your main clinical strengths and areas for professional growth?
My primary strengths are strong clinical assessment skills, calm emergency management, and effective patient communication. When a patient deteriorates, I don't panic. I just work the problem. For growth, I'm focused on adapting to international electronic health documentation standards, gaining more exposure to critical care technology like ventilator management, and expanding my specialized clinical certifications.
Where do you see yourself professionally in the next 3 to 5 years?
In 3 to 5 years, I aim to be fully integrated into the health system, holding advanced clinical certifications in acute or critical care, and serving as a charge nurse or preceptor, mentoring newly onboarded international nurses the way senior staff once mentored me.
How do you prioritize your workload when managing multiple deteriorating patients?
I use the standard ABCD triage framework, addressing immediate life-threatening issues involving airway, breathing, and circulation first. I delegate stable routine tasks to support staff, call for urgent physician review, and continuously reassess as situations evolve. Deteriorating patients need more hands, not just faster ones.
What process do you follow to ensure safe medication administration?
I adhere strictly to the rights of medication administration. Right patient, right drug, right dose, right route, right time, and right documentation. I check the MR against the prescription, verify patient ID bans and allergies, and perform independent double checks for high-alert medications. If anything looks off, I stop and clarify before giving it, even if that slows me down.
If you make or discover a medication error, what immediate steps do you take?
Patient safety comes first. I immediately assess vitals and monitor for adverse reactions, and get medical help if needed. I notify the attending physician and charge nurse right away, administer any prescribed corrective interventions, and complete an objective incident report per hospital protocol. I don't try to cover it up or fix it quietly. Transparency is non-negotiable.
How do you maintain accurate documentation and electronic health records during a busy shift?
I document in real time or immediately after interventions rather than batching it at the end of the shift, since memory fades fast when you're busy. I keep a small worksheet during rounds, so I don't lose details, then transfer that into the EHR. Keeping entries factual, concise, objective, and compliant with charting standards for seamless handovers.
How do you perform a systematic patient assessment?
I follow the ABCD method: airway, breathing, circulation, disability, exposure, along with a head-to-toe assessment. I gather vital signs, do a focused physical exam relevant to the primary complaint, review history and diagnostics, and promptly report abnormal findings to the medical team. This keeps me from missing something critical, especially when time is short.
How would you respond if a patient suddenly experiences acute shortness of breath or chest pain?
I sit the patient upright, apply supplemental oxygen if indicated, take an immediate set of vitals, including oxygen saturation, and call for urgent medical assistance. I prepare emergency equipment like an ECG machine and emergency medication tray while waiting for the doctor, and I keep reassuring the patient throughout. Panic makes breathing worse.
Describe a situation where you had to advocate for a patient's care or safety.
I once noticed a prescription dosage that appeared too high for a patient with reduced renal function. I privately raised the observation with the prescribing doctor. We reviewed the renal dosing guidelines together, and the prescription was safely adjusted. It reinforced for me that speaking up matters as much as following orders.
How do you handle an aggressive, upset, or non-compliant patient or family member?
I stay calm, keep a non-confrontational posture, and use active listening to validate their feelings without being defensive. Usually it's fear or frustration talking. I explain procedures clearly in simple terms. If there's any risk of physical harm, I prioritize safety, step back, and call senior staff or security rather than letting it escalate further.
How do you ensure strict infection control protocols are followed in your daily practice?
I practice strict hand hygiene following the WHO 5 moments, wear appropriate PPE based on isolation precautions, ensure proper surface decontamination between patients, and maintain a septic technique during invasive procedures. It becomes automatic once it's a habit rather than a checklist, even when the ward is slammed.
How do you resolve a professional disagreement with a senior colleague or doctor?
I handle it privately, respectfully, and objectively, never in front of the patient. I focus entirely on evidence-based practice and clinical facts rather than opinions, framing it as, I noticed X, I'm concerned about Y. If it's a patient safety issue that isn't resolved, I escalate through the proper channel.
Describe a time you witnessed an unsafe or unethical practice. How did you handle it?
When I noticed a colleague accidentally compromised a sterile field during a procedure, I stepped in politely to supply new sterile equipment before continuing. Afterwards, I discussed the breach privately with them and logged the incident through the proper safety and safeguarding channels. It's uncomfortable, but patient safety has to come before workplace comfort.
How do you delegate tasks effectively to junior nursing staff or support personnel?
I evaluate the staff member's scope of practice, experience, and current workload before delegating. I give clear, precise instructions, monitor progress, and remain ultimately accountable for the patient's overall care, while making myself available if they're unsure, since new staff shouldn't feel like asking questions is a weakness.
What steps do you take to maintain patient confidentiality and privacy?
I lock computer terminals when leaving stations, keep physical documents out of public sight, draw curtains during consultations, and only discuss patient details in clinical areas with people directly involved in their care.
How do you deliver culturally sensitive care to patients with diverse backgrounds or beliefs?
I ask patients and families about their dietary, religious, and personal preferences rather than assuming, and show respect for their practices, including who they want involved in decisions or present during care. I use official medical interpreter services whenever language barriers arise.
How do you manage personal stress and prevent burnout while adapting to a new country and healthcare system?
I build a healthy daily routine early. Exercise, balanced nutrition, regular contact with family back home, and actively engage with work colleagues and local community groups to adapt smoothly. I'm also honest with myself about when I need a break instead of pushing through.
How do you approach communication when caring for a patient facing a language or cultural barrier?
I avoid relying on informal family translation for clinical decisions and instead engage certified hospital interpreters or phone translation services. I speak at a deliberate pace using plain language, use visual aids or demonstration where helpful, and check understanding by having the patient repeat back what we discussed rather than just asking, "Do you understand?"